Zahedin University of Medical Sciences response to the coronavirus disease 2019 outbreak at Iran-Pakistan border crossing. Islamic Republic of Iran is a committed and responsible member of international health organizations, and international health regulations are carefully implemented and monitored at all Sistan and Baluchestan Province border crossings. Mirjava Border Health Surveillance Unit is active throughout the year. As an example, more than 100,000 Pakistani pilgrims who entered the Iranian border during Outbreak 2019 received health checks at the point of entry. Given the fact that public health checking and timely and transparent provision of health information is a mutual responsibility of the countries, contributing to the health of the international community, all Pakistani pilgrims and travelers seeking to cross the Iran-Pakistan border are screened and controlled for coronavirus disease at the border crossing point. In response to the coronavirus disease outbreak, a total of 10 staff members from Mirjava District Health Center have been deployed to Border Health Surveillance Unit located in Mile 72 Iran-Pakistan border area. These staff members include physicians, disease control officers, environmental health experts, and emergency paramedics.
As the world is witnessing the spread of corona disease, Zahedin University of Medical Sciences has boosted implementation of international health regulation. That means at all border crossings, including Mirjava crossing, which this is the place we are located at the moment, we are screening all the travelers, all the people wanting to cross the border for coronavirus. They get screened for the symptoms, including fever, cough, and also the shortness of breath. And if in case of suspected cases, actually we have a medical team here ready to start all the activities according to the guidelines provided by the Iranian Ministry of Health. And so far we've screened more than 3,000 travelers from including Pakistani nationals. And all those travelers who have no signs and symptoms of coronavirus, they have been issued with a health certificate that actually mentions the traveler has no symptoms. And this is according to international health regulations. At this place, we have a medical team including medical doctors, disease control officers, environmental health officers, and also we have medical emergency teams. We have a mobile diagnostic lab available here. We have ambulances and a bus ambulance which is ready in the case of emergency situation. We are ready to implement and launch all the services needed here.
Quarantine station with 10 beds has been prepared at Mile 72 Iran-Pakistan border area for accommodation of possible suspected coronavirus disease cases during a 14-day quarantine period. Travelers coming from areas that have been designated at high risk for exposure to COVID19 will be quarantined for 14 days if needed. Mirjava Darushafa Hospital, a 32-bed general hospital which is located 17 kilometers from Iran-Pakistan border crossing, has also been prepared for admission for suspected coronavirus cases.
In order to protect all the patients from infectious diseases, we started infectious disease triage at this hospital. That means the emergency department physician or nurses, when they encounter a patient which is suspected of corona disease, they would be referred to another room which has already been prepared for processing, for examination and investigation of the suspected corona cases. And they can take the samples at that site, and if the infectious disease specialists confirm that this is a suspected cases of coronavirus, we also have prepared another area for hospitalization of disease, and we are doing all our best to prevent the spread of disease, and our priority is to diagnose the cases as soon as possible, and also in the case of suspected cases also we do the investigation of close contacts. That means we go to the households, we actually investigate all these close contacts and family members for symptoms and coronavirus disease, and we follow up them for at least 2 weeks for symptoms of the disease. And also we train them how to protect themselves and what measures they have to take to prevent the spread of disease to other community members. In addition to disease control activities and measures, also we have environmental health officers available here, and they are in charge of overseeing the health of drinking water and also foodstuff health, and also they implement some environmental health activities, including disinfecting all the surfaces and also waste management in this area. And this is an ongoing service. There is a non-stop service, and this is an activity that has been done day in, day out, and we are doing our best to guarantee the health of all the people who are crossing the border, and also our colleagues here at the border, Iran-Pakistan border.
Incoming and Pakistan-bound travelers are screened for fever, cough, and shortness of breath. Any travelers with signs or symptoms of illness will receive a more comprehensive medical assessment. Since February 28, 2020, more than 4,415 Pakistani travelers have been screened for coronavirus disease, and they have been issued with a health certificate before leaving the country.